Well, hello, friends, and welcome to another episode of the Mama Doc Baby Doc podcast. Thank you so much for spending some of your time with us today. And as always, we really do appreciate it. I'm Renda. I'm an OBGYN physician, and I'm here with my daughter, Rachel, who is a pediatrician. Hi, Rachel.
Hi, Mom. And hi to all of our listeners. Our podcast is really starting to become more popular. Every week we get new listeners, which is so exciting. So thank you so much for listening. If you enjoy our podcast, we would appreciate it if you would take time, give us a rating and review. That really helps other listeners find us too. I actually had a patient tell me she was just looking stuff up on YouTube and found our podcast.
Yay!
So
That's
I
awesome.
know. So giving the rating and review just helps the YouTube algorithm kind of move us to the forefront a little bit. And really tell your friends, especially your pregnant friends.
Yes, especially your pregnant friends, right?
That we're here. So in this episode, we're going to talk about midwifery. Some of our listeners may know a lot about midwifery care. Some may have a midwife or have delivered with a midwife. But many moms in the United States really don't. Most deliveries are attended by doctors. So today, we're going to talk about midwives and what they do.
Right. And the midwifery model of care, quite frankly, is really a good model of care. All of us who work in maternal health should really learn about it, know about it, and implement some of the aspects of midwifery care into the care that we provide, even as doctors. Now, as a patient, you should always look for these elements in the care that you receive, regardless of whether or not you have a doctor or a midwife. Now, I personally have worked with midwives since I was a medical student in Tampa, Florida, way back in the day. I think I had my first delivery that I attended. It was with a midwife in 1994. Now,
Wow.
some of our listeners may not have even been born yet. I realize that at various points in my career, I've worked with midwives. And today, in the practice that I have in Alaska, I also work with midwives, with certified nurse midwives in my hospital. So I'm an OBGYN physician. I provide backup coverage for midwives when patients need extra assistance with their delivery or have high risk complications. And I work side by side with certified nurse midwives. And I want to be clear that I do support midwives, and I support that we should work collaboratively together to help provide the best care for our patients, including I also work with home birth midwives. Now, I do not do home births. I have never been to a home birth. I do not recommend home births, to be quite honest, because I've just seen too many things go wrong. Home
Yeah.
birth is not my lane. Hospital birth is my lane, and that's where I'm going to stay. But I do know that the research regarding home birth is out there, and that for many women, home birth is an option that they choose under certain circumstances. And I would really only recommend that for low risk people. But one of the important circumstances surrounding home birth is making sure that they have a good backup plan in place where people can be transferred from their home to the hospital, and that can happen seamlessly if they need to get extra care. So I am a backup for home birth midwives. I support being a backup on the hospital side if a home birth transfer needs to happen.
Yeah, and really, I think in this episode, you're going to learn about what midwifery is. You'll learn about the tenets of midwifery, the different types of midwives, the certified nurse midwives, certified professional midwives, and the differences in education and training and scope of practice and legal status because it really differs state by
Right.
state. And I think you're going to talk a little bit about information on how midwives practice in the US and all the information that you're going to be covering in this episode applies to midwives in the US, and then different types of practices and collaborations that happen with physicians too, which is really there's a little bit of controversy. So I think that's what we're going to cover today. So go ahead.
Yeah. So one of the things that I know for sure about midwives is that they support childbirth education. They do a great job, an excellent job of educating patients about pregnancy, about childbirth, breastfeeding, and even newborn care. So one of the reasons why a lot of women choose midwifery care is because of the more holistic approach and the level of care that they provide. They give a little bit more time, a little bit more attention, and a little bit more education to women during the pregnancy.
Yeah, but I also know that not everyone has access to midwives. In fact, most people don't. Most people still deliver with a doctor. And great childbirth education can be something that helps to kind of fill in the gaps, helps you feel a little bit more secure, really a lot more secure.
Yeah.
um, okay, so why don't you start off by answering the question, what is midwifery?
All right. Yeah. So most of the information I'm giving in this episode comes from the website from the American College of Nurse Midwives. And that's similar to ACOG, which is the American College of Obstetrics and Gynecologists. ACNM is the specialty organization for midwives that's similar to the organization ACOG that I belong to. Now, they talk a lot about the art and science of midwifery being characterized by several hallmarks. And I'm just going to read right through them because it's a bunch. Okay. They their hallmarks, the things that they find important are recognition, promotion, and advocacy of women through menarche, and that's the start of your period, pregnancy, birth, and menopause, recognizing those things as normal physiologic and developmental processes. They are they advocate for non-intervention and physiologic processes in the absence of complications. So, not intervening in the birth process unless you need to. They incorporate evidence based care into their clinical practice. They promote person centered care for all, which is inclusive of diverse histories, backgrounds, and identities. They really advocate for the empowerment of women and anyone seeking midwifery care. They want to be partners in healthcare, facilitation of healthy family and interpersonal relationships, promotion of continuity of care, utilization of health promotion, disease prevention, and health education. So they will also advocate for vaccines when appropriate, application of public health perspective, utilizing and understanding social determinants of health to provide high quality care to all persons. They advocate for informed choice, shared decision making, meaning patients have the right to decide about their care. They're big on cultural safety and integration of different aspects of a patient's culture into their care encounters. They also integrate a lot of the evidence-based complementary and alternative medicine types of therapies, like using different supplements and acupuncture and Chinese medicine. I think midwives are very skillful at communication and at counseling. They are very strongly acknowledge the therapeutic value of the human presence. And I really love that one. So it means advocate for the ability to collaborate with and refer to other members of the healthcare team. Now, the final hallmark of midwifery put forth by the American College of Nurse Midwives is the ability to provide safe and effective care across settings. So that includes at home, at a birth center, at a hospital, or any other maternity care service.
Awesome. Yeah. So those are the tenets that encompass midwifery care. Again, from the American College of Nurse Midwives. And as you can see, it really offers a more holistic approach to care than in practice, medical practice at a hospital. And I would say midwives usually take a lot more time with their patients compared to physicians. So let's really get into the types of midwives, the training they undergo, their education, their legal status, that kind of stuff.
Okay, good. So we're going to start with the different types. There are certified nurse midwives, those are the CNMs. certified midwives, or CM, and certified professional midwives. And they are not the same. They're all very different. So for certified nurse midwives and certified midwives, the first two, as of 2010, a graduate level degree is required for certification as either a CNM or a CM. And so a graduate level of degree would be like a master's degree or a doctoral degree. And approximately 82% of nurse midwives have a master's degree, and about 5% of CNMs will have a doctoral degree. And I do think that number is going up.
Okay. And, typically it is a doctor of nursing practice. Now, this can cause some confusion because, yes, it is a doctoral level degree, so they could be called a doctor, but it's a doctoral level degree similar to a PhD. So a doctoral level degree and could be called a doctor of nursing practice. That level of a doctor is not a clinical level of being a doctor. There was no med school, things like that.
Right. So there's a lot of controversy as to whether or not someone who has a doctor in nurse practitioner degree should call themselves doctor in a clinical setting, because it's confusing for patients. And so when patients hear doctor, they think medical doctor and with the attached knowledge and level of experience and training. And it's really just not the case. Now, I'm not like throwing shade or anything like that. Yes, they earn the title, but in the clinical setting, to call yourself a doctor if you don't have an MD or a DO is confusing for patients. And there's a lot of controversy about that.
Yeah. Okay, so tell us about the training for the different types of midwives.
Right. So as far as the minimum requirements to get into a midwifery program, you have to have a bachelor's degree or higher from an accredited college or university. And to be a CNM, you also have to have earned an RN license. So you have to be a registered nurse prior to or within the context of the midwifery education program. You also become a registered nurse. Now, the certified midwife program is a little different. It was only developed in 1994 in order to expand access to midwifery through creating another educational pathway to get your midwifery degree. So a certified midwife pathway, they do not have a graduate degree in they don't have to be boarded through the American Midwifery Certification Board. They differ because they don't have a nursing license, basically. So the only difference is that they don't get a license as a nurse as well.
Okay, so that makes sense. So the only difference is certified midwives don't have to be licensed as nurses, and certified
Right.
nurse midwives also have the nursing license.
Right, that's right. So certified midwives and CNMs meet the same core competencies. They sit for the same exam, they have identical scope of practice. They're otherwise identical, except that CNMs also have that nursing or RN license. Now, CNMs, certified nurse midwives, are licensed in all 50 states, plus the District of Columbia, and all U.S. territories. Sometimes they're licensed under different names. They practice as midwives, but they may be licensed as a midwife, a nurse midwife, an advanced practice registered nurse, or a nurse practitioner. They have the ability to prescribe medications, including controlled substances as well. Certified midwives, the ones without the nursing credentials, that type of midwife is actually only recognized in a handful of states. So it's only recognized right now in Delaware, Hawaii, Maine, New Jersey, New York, Oklahoma, Rhode Island, and Virginia. So not in Alaska where I live, and not in Colorado where you live, Rachel.
No. Or in Kentucky where I trained, it sounds like.
Right. Yeah. No.
So now, when we look at the scope of practice for certified nurse midwives and then certified midwives, they're the same, really. A lot of people think midwifery in relation to birth, but actually, it encompasses a full range of primary health care services for women, honestly, all the way from adolescence to beyond menopause. So, certified nurse midwives, certified midwives, both can do preconception care, care during pregnancy, childbirth, postpartum. They can actually do care of the normal newborn period during the first 28
Right.
days of life, although I don't think that's very common, honestly. They can do primary care. I do know plenty of midwives that do gynecologic care and family planning services as well.
Right.
And they can even treat male partners for sexually transmitted infections. They will do initial assessments, ongoing assessments, diagnosis, treatment, physical exams. They'll prescribe medications, like you said, including controlled substances. They can provide contraceptive methods. Some midwives will place IUDs even. Um, they can admit patients to the hospital, manage patients in the hospital, discharge patients from the hospital, order, interpret labs that are in the hospital, um, order and use medical devices. But of course, midwifery also includes education, health
Right.
promotion, disease prevention, all of those things. So it's actually a lot more than what people realize. Most are focused around the pregnancy and birth, but many do a lot more, and they practice in all settings: hospitals, homes, birth centers, offices. The majority of nurse midwives, though, and certified midwives attend births in the hospital. Yeah.
Right, right. And finally, for insurance coverage, almost all private insurance will cover care by a certified nurse midwife. Medicaid, which is the insurance coverage for people who have financial need, is actually mandated in all states to cover certified nurse midwives. Medicare and also TRICARE, which is military insurance, will also cover certified nurse midwives. Now, for certified midwives, most private insurance will cover them, and it's only covered in the handful of states that we talked about. Now, as far as education and training to become a midwife, the Accreditation Commission for Women with Free Education is the official accrediting body who certifies and accredits the nurse midwifery and certified midwife, and also the certified nurse midwife programs. Right now, there are 38 accredited midwifery education programs in the United States. Midwifery school is 2 to 3 years, between 2 to 3 years. So they do have to have the undergraduate degree, so 4 years, and then the midwifery school for 2 to 3 years, and then they can go out and practice as a midwife. Now, that's a bit different from medical school. For me as a physician in my training, I'm going to say specifically OBGYN. So I had to do 4 years of undergraduate, then 4 years of medical school, and then an additional 4 years of my OBGYN residency. Now, keep in mind, as an OBGYN, there's obstetrics and there's gynecology. So I'm learning more than just pregnancy and birth. And although midwives are as well, I'm also learning how to do surgeries, procedures. So it's a much longer and more involved training process.
Yeah. Certified nurse midwives and certified midwives, they are certified by their board of organization and they get recertified every year. It's kind of like a rolling certification process, the same thing as physicians. Okay, so let's talk about certified professional midwives, CPMs. Now, certification as a CPM does not require an academic degree, correct?
Yeah, that's right. It's just based on a demonstrated competency in specified areas, knowledge and skills related to pregnancy and the postpartum period. So the minimum education requirement to get admitted to a certified professional midwife program is a high school diploma or equivalent. And prerequisites for accredited programs vary, but typically it includes a few courses like maybe microbiology or anatomy and physiology, and some experience with childbirth education or being a doula. Now, the organization that kind of oversees certified professional midwives is the North American Registry of Midwives, and there's no specific or specified requirements for entry to that program. In general, it's like an apprenticeship program that includes verification of knowledge and skills by qualified preceptors. Now, they do require that the clinical component of the education process, so that actual hands-on of being part of birth, must be at least 2 years long and must include a minimum of 55 births. The clinical education also must occur under the supervision of a midwife who must be nationally certified, legally recognized, and who's practiced for at least 3 years and attended at least 50 out of hospital births after their certification. Okay.
Okay. Can you talk about the scope of practice for a certified professional midwife?
Yeah, the certified professional midwife is a bit different. They offer care, education, counseling, and support to women and their families throughout the caregiving partnership, but it usually includes pregnancy, birth, and postpartum. They do provide ongoing care throughout pregnancy, continuous hands-on care during labor, birth, and the immediate postpartum period, and then they do the mom and the baby care through 6 to 8 weeks postpartum, roughly. So they're primarily focused on the pregnancy, the immediate postpartum period. They can do an initial assessment, ongoing assessment, and some diagnosis and treatment. They're trained to recognize abnormal or dangerous conditions that require consultation with another healthcare professional, like a certified nurse midwife or a physician. They do things like physical exams. They can administer some medications as allowed by state law, but most of them cannot give out prescriptions. They do not have prescriptive authority. An example of when a certified professional midwife can administer medication is, for example, for Group B strep, GBS. If a woman is GBS positive and needs antibiotics during labor, then they can administer that. But typically, they can't write prescriptions or give out other medications. They almost exclusively practice in home birth centers, in offices, or in patients' homes. The majority of certified professional midwives attend birth in a home or in a birth center. You're not going to see a certified professional midwife in the hospital. Their level of knowledge and understanding of birth is not the same as a certified nurse midwife, and they don't have the same role.
Yeah, and I think I didn't know the difference until you told me, and I think probably
Yeah,
many patients don't know the difference. You kind of
right.
just hear midwife and you think all midwives are equal, but they're not. I mean, just kind of what we talked about, the certified nurse midwife. Correct me if I'm wrong, you said they only have to be a part of 55 births for their training.
Certified professional midwives only have to be a part of
Professional.
55 births, and they don't have
Yeah.
to, they don't get any graduate level degree. They only have to be a high school graduate and follow someone through a bunch of births. Yeah.
Yeah. That would make me nervous as a patient to go see someone who had only
Yeah.
been a
And
part of
and
that many.
some of them have great experience. And I think if they're quick to recognize when they're in over their head and send the patient to the hospital, then they're fine.
Yeah. Okay. So another thing is insurance coverage. Most insurances, private insurance, do not cover certified professional midwife. Hence,
Right.
it doesn't cover that home birth in most states. It is mandated in a few states. I think like 5 or 6. I don't know the states. That it is mandated in it on top of my head, but it's only a handful. And where that private insurance will cover a certified professional midwife. In some states, about 10 states or so, certified professional midwives are covered by Medicaid.
Okay.
So, if
So
you're thinking about using them, you probably want to reach out to
you
your
want to check that out.
insurance. Yeah, to
Right.
make sure.
Okay, so let's give some facts about midwives and how they practice in the United States. So, the American College of Nurse Midwives, and again, this is where most of the content from this episode comes from. They're the professional association that represents CNMs and CMs in the United States. And again, I'm focusing on midwifery care in the United States. Midwifery care outside of the United States is completely different. Outside of the US, midwives are in much higher number. They take care of almost all of the low risk patients. That are coming in for delivery. Physicians are only reserved for complicated cases, and it's not that way in other areas. That's the way it is in other areas of the world, but not that way here. Okay, so as far as numbers of midwives, in 2019, the last time they had data available, there were 12,218 CNMs and 102 CMs. So you can see the vast majority are certified nurse midwives, especially those practicing in the hospital. Now, that is compared to about 40,000 OBGYNs in the United States. So 12,000 nurse midwives, 40,000 OBGYNs. Keep in mind that not all OBGYNs do pregnancy and prenatal care, right? Some just do gynecology. Some OBGYNs are specialists, and that would still fall into the category of OBGYN. Like some go on and do a specialty in infertility, like reproductive endocrinologists. They're a fertility specialist. Some do GYN surgeries, or GYN cancer surgeries, gynecologic oncologists. So it's not really a direct comparison, but that does just kind of give you an idea of the numbers. And in 2019, from the National Center of Health Statistics, 9.8% of births in the US were attended by a nurse midwife. And there's about 400,000 births a year, roughly, that are done by a midwife. There are about 4 million births every year. And 400,000 will be done by midwives, and the rest done by OBGYN physicians. 94% occurred in hospitals, 3% occurred in freestanding birth centers, and 3% occurred in homes, in patients' homes. So hospitals do still tend to be the place where people give birth the most.
Yeah, yeah. Now, of course, as you've said multiple times, although we know midwives are very well known for pregnancy and birth care, actually about half, 53% of CNMs and CMs identify that they do reproductive care as well, and 33% identify that they do primary care as the main responsibility in their full-time position. So that may include doing things like annual exams, writing prescriptions for contraception, and reproductive health visits, things like education and counseling. They do other things as well.
Right. Yeah. Some midwives do a lot more than just pregnancy and birth. And now, as far as where midwives work, more than 50% report that they work with a physician practice or with a hospital or medical center as their employer. It's not as common that you're going to see independent midwifery practices, because a lot of them require that physician backup. And I'm going to talk about why that is. There are different types of practices and different types of collaborations depending on the state that you live in. But when you look at how midwives practice and how they collaborate with physicians, there are some good collaborations and relationships, and then there are some not so good collaborations and relationships. And there's tension on both sides. So there are some physicians who fully embrace midwifery care, like myself. I'm working with them, and fully embrace that whole model. But some physicians just don't like working with midwives at all. Some are worried about the liability. And what I mean by that is, if we're in a collaborative relationship and the midwife does something that's considered dangerous or harmful to a patient, then as the physician who is their collaborative physician, I'm at risk for being sued or in trouble for it, because I am in this collaborative relationship with the midwife. Also, some physicians have some hesitancy to forming that relationship with home birth midwives, again, because they're worried that they're taking on liability, that if something goes wrong, which can happen in a home birth, it's not without risk, and that if something goes wrong, then the physician is going to be blamed or held at fault because they entered into this relationship with the midwife. So, not saying that practically happens, but that certainly is a concern, and it's not something that can be completely excluded as a possibility. And then there are some midwives who just don't like working with physicians. They feel that they should have more independent responsibility and the ability to practice. So there's good relationships and there's bad relationships, and there's tension on both sides.
Yeah, and I think that comes with being human and working with people.
Right.
It's not just that relationship, it's really any relationship. If you're working with someone else, there are going to be people you like to work with and people you don't like to work with.
Right. That's true.
But I think, working together, we can all try to do better. It would be better if we could all work together. And honestly, it just can be a little bit complicated. That's all. So when you think about the ways that midwives and physicians work together, there are 3 different types of ways that things can happen. So midwives can be in a state where they have an independent practice, meaning that they have no need, there's no requirements that they have any sort of formal agreement to work with the physician. They can be an independent practice, so they don't have to have a physician that they work with. And I think that depends on the state and like the legal requirements of the state. Yeah. Now, keep in mind that midwives need to have some sort of connection with physicians because they need to have a place to send patients to if there are complications.
Right.
That's how systems outside of the US work very well, is that when midwives aren't comfortable with low risk things, they send them to physicians. So they need to have some sort of relationship. And in some states, it's required that you have those agreements in place for
Right.
midwives to even practice. But in 28 states, they can practice independently. They don't have to have that formal agreement in place. But in 17 states, they have to have a collaborative agreement in order to practice. And this is a bit of a sticking point. um, and then the rest, just a handful, 3 states have a hybrid model where there are some restrictions in place, but not quite as much as the collaborative agreement. And 3 states actually have a supervision requirement in place where a physician actually has to supervise the practice of a midwife. And that adds another level of documentation and responsibility and things for the physician, whereas the collaborative model doesn't really require that.
Right. And I personally have a collaborative agreement with midwives. I don't supervise them.
Yeah.
They practice independently. They come to me with questions or concerns. I don't oversee their day-to-day practice. In a collaborative agreement where supervision requires any more than just being available for consultations, for questions, and to help care for patients that maybe have a little bit more high risk problems. So again, in 28 states, midwives can practice independently. In 17 states, they have to have a collaborative agreement. And then in 3 states, they have this hybrid model that require supervision where the physician actually has to be there watching them in order for them to practice. Now, for collaborative agreements, there is, as I said, some controversy. And the controversy is that when you break it down, ACOG, the American College of Obstetrics and Gynecologists, believe that collaborative agreements need to be in place. The American College of Nurse Midwives does not.
Oh, okay. So they want midwives to practice independently, but also have the ability to transfer care seamlessly when indicated. And they note that requiring a signed collaborative agreement with the physician doesn't guarantee effective communication between
Yeah.
midwives and physicians. And I'm sure that's
Yeah.
true.
Yeah.
It doesn't assume that the physician is available when needed, which is also
Right.
true.
Right. And there really is no evidence that having these signed collaborative agreements increases safety or quality of patient care. Okay. So there's no evidence that it's necessarily of any benefit. Also, collaborative agreements that are signed by physicians wrongly imply that the midwife needs to be supervised, right? Um, so it's definitely a sticking point, and I hear it a lot. The people think that midwives have to be supervised, and they really don't. They practice independently. And collaborative agreements, the one that I have, does not mean that I'm supervising them in their day-to-day care. I think that's a misconception.
Right.
Sometimes nurse midwives are restricted from being able to practice because in some places they can't receive hospital credentials and get clinical privileges and reimbursement from insurance or services that would normally fall within their scope of training and within their license scope because they don't have collaborative agreements, right? And it's actually a bigger problem or a big problem in the southern United States, in the Southeast particularly, where there's a lot of access to nurse midwives for this where there's not a lot of access to nurse midwives for that very reason, that physicians don't feel comfortable signing a collaborative agreement or finding a physician who is comfortable to sign that agreement with the midwives can be really challenging. So it limits their ability to have practices in those settings. And collaborative agreements also have been used as a way to limit the number of midwives who can practice with any one physician. And it creates these ratios of nurse midwives to physicians, and that can actually restrict access to care, restrict choice of providers for women. And it's a concern in underserved areas in particular where physicians are not always as likely to go. We have a lot of
Yeah.
places in our country where the birthing centers and hospitals are being shut down, and because they don't have physicians to oversee their deliveries, but there may be midwives who are willing to go into these underserved areas, but they can't because they're being hampered by the need to have a collaborative agreement. Yeah.
Yeah, that's really sad because I agree that like women should have their choice of who they go see
Yeah,
and who's their provider. And it's sad that some of the legal things are getting in the way of whether or not you can have access to that care. So that's really sad.
right,
There are many areas in the US that are like what we called care deserts, where you can barely find any OBGYN care. I mean, that's the
right,
same with pediatrics too. There's just,
right,
no providers there. And it's been thought that, certified nurse midwives would do a great job filling that gap in some
right.
of those rural areas and taking care of those patients.
Right. So I happen to work at a critical access hospital. It's a very small rural hospital where the nurse midwives do the majority of our deliveries, and then they consult with the OB physicians when they have a high risk patient or whenever they need assistance. And I firmly believe that working together, we can optimize women's health care. When we work well together, it's a
Yeah.
great benefit to patients. They get more personal care, they get better education, they get more time with their providers, and they still have access to the higher level of care when needed.
Yeah, exactly. So if you're listening, you may be in a state that has independent nurse midwife practices, which means it could be a group of midwives and there are no physicians in the practice. They probably have some sort of backup physician agreement available, even if it's not formal. But you may be in a model where it's just a group of independent nurse midwives. I think that what's more common is that midwives are a part of a physician practice
Yeah.
and they all kind of work under a practice together. And midwives see low risk patients and see their own patient pools and deliver their own patients. And then, some models actually have it where midwives attend all of the births and the physician
Right.
only, participates in the C sections or the operative vaginal deliveries or like with vacuum or forceps, things like that.
Yeah. So my thoughts on midwives, as I said in the beginning of this, is that we need to work together. And I actually personally believe that nurse midwives should always have an established relationship, whether it's formal or informal, with a physician of some sort or some sort of group of physicians. There needs to be those relationships in place because that is what best is going to benefit the patient.
Yeah.
I think it's not a good idea for your midwife to not have someone who she knows and trusts so she can go
Yeah.
to them if something is going wrong or if she needs to bring a patient to the hospital. Um, or if we're part of an independent group and the patient needs to be transferred, you want to have those relationships set up ahead of time. And you want that transfer to be seamless because, again, that is in the best interest of the patients. I think we're getting better. We still have work to do, more work to go, but I definitely think we're getting much better at that.
Yeah, for sure. So, just to recap, midwifery in general emphasizes a more holistic and patient centered approach. We can definitely learn some of the pearls of midwifery. I have taken away some of the things from midwifery for sure in order to help improve the care. And I'm sure you have too,
I
that
have, yeah.
you provide for your patients, but just listening to the list, I think they're really great. And as far as types of midwives, there are certified nurse midwives, certified midwives who are the same. They're the same in terms of scope of
Right,
practice and what they can do in their practice. The difference is that certified midwives do not have a nursing license. And
right.
then there's certified professional midwives who attend home births, birth center births. And the practice structure is really going to differ depending on your state. So if you have a friend in a different state, then her midwifery care might be different than what you experience.
Right. It really does depend on what happens in your particular state. And then finally, again, midwives and physicians really need to work together in order to provide the best care for our patients. Those relationships need to be seamless. They should be collegial. We should be able to work together. Midwives can provide great care and be a great asset to patients. So, shout out to all the midwives I've worked with in my career and continue to work with on a day to day basis. I definitely believe that we can get there to the place that we provide the best options for our patients. It's going to take time, but again, progress is slow, but it is possible.
Yeah, that's wonderful. Okay, so that's all we have for today. Be sure to subscribe to the podcast and Apple Podcasts or wherever you're listening right now. And we would really love it if you leave an honest review. In Apple Podcasts in particular. So it really helps other women find us. But, anyways, bye for now. Have a great week. We'll see you next week.
Bye.
Bye.